For the next session, I would want to request Dr. Pradeep Deshpande sir, Professor Emeritus, Nizam's Institute of Medical Sciences, Hyderabad. Dr. Uttara Das ma'am, Professor and HOD, Department of Nephrology, All India Institute of Medical Sciences, Mangalagiri. Dr. Ramchandra sir, Senior Consultant and Head of the Department, Department of Nephrology, Medicover Hospitals, Karimnagar. And Dr. Payal ma'am, Assistant Professor, Department of Nephrology, Nizam's Institute, to please be on the stage for chairing the session.
Good morning, everyone. Now we have an interesting debate between mixed diet and plant-based diet. I have with me Uttara Das, Dr. Ramchandra and Dr. Payal. Uttara Das is also professor and is in Mangalagiri Institute. So the first talk is going to be by Anurag Gupta. He is from North and from Gangaram Hospital, and he is secretary of the Delhi Society. Is Balan, who is a senior consultant nephrologist at KIMS Health Trivandrum. Both have major achievements, both have many papers, and I would suggest that they will stick on to time, and I would take an opportunity on behalf of everyone to call Anurag Gupta to deliver his oration.
Thank you, sir. I thank the organizing committee for giving me the opportunity to speak on this topic. So, the basic is what we are, what we eat. The vegetarianism concept, vegetor, Latin root giving strength and health, and the plant-based diet got strength from 20th century onward, and most studies came after that. If you go through the history of the vegetarian nutrition in most of the country, what was the basically diet? It was all plant-based. And over national hero, Mahatma Gandhi ji said, there is enough for everybody feed, but not enough for everybody greed. And being Indians, what is our traditional food classification? Sattvic diet, Rajasic diet, and Tamasic diet. And fruit-based diet, whole grains, legumes, they decrease inflammation, increase insulin sensitivity, increase gut diversity, and increase metabolic health. And with Tamasic and Rajasic diet, there is restlessness, stress, and various issues. Even in Bhagavad Gita, the chapter 17 and verse 8, they said the sattvic food promotes health, strength, happiness, and longevity. And the vegan concept comes recently, but it is historical in Indian culture, from Vedic food, ahimsa, regional cuisine. And so the veganism in India is ensured traditional, modern, sustainable life. In most of the Indians, they are lacto-vegetarian, and very few Indians, they do not, they consume the eggs. There are 9 patrons of diet in India. In some region of India, even the fish is considered as the fish vegetable of the sea. Now this is important. Leaky gut. In CKD what happened? There is the gut dysbiosis, and gut dysbiosis causes the leaky gut, increase in the uremic toxins in the form of precrystols, indole, and TMA, and which causes inflammation. And cardiovascular, kidney, metabolic health is also important, and I want to highlight that stage 3 is considered as a subclinical CVD, and stage 4 and stage 5 is basically a high risk for CKM syndrome. CKD patients, they have almost 6 times more chances of cardiovascular events as compared to the normal populations. Now comes to what are the guidelines for plant-based proteins in CKD. All major guidelines, they said the protein should be 0.6 to 0.8 gram per kg body weight. And if you combine it with keto analogs, you can lower it to 0.3 to 0.4. But what about plant-based diet? KDIGO clearly preferred plant-based diet as compared to the animal-based diet, whereas KDOKI is unable to give command you consume plant versus animal, although they have included the Mediterranean diet and fruit and vegetables. And then the concept of plateau came. The most important thing is, okay, plant-based diet, but you have to fulfill the energy also of the patient with the form of 30 to 35 kilocalorie. I will go with the energy also along with the plant-based diet. So there is a modern shift to the plateau diet. But why we want plant-based diet in CKD? It decreases the incidence of CKD and CKD progression, decrease complications of chronic kidney disease, decrease risk factors for chronic kidney disease, and potential risk we will discuss whether they are facts or myths. Decrease incidence of chronic kidney disease without pre-existing CKD, several observation studies, cross-sectional studies, prospective studies. And they have shown that this TLC-GS study shows that 30% lower risk of CKD on plant-based diet. This is one of the largest study, ERECT study, which included almost 12,000 people with 20 years of median follow-up, and red and processed meat consumption increased CKD risk. And this study is from the Singapore. Almost 63,000 people with a follow-up of 15 years and who take high red meat intake has a 40% high risk for developing kidney failure. And if they replace 1 serving of red meat per day with soya and legumes, they have a 50% reduction in risk of kidney disease, kidney failure. And these studies also favor the plant-based diet. And this study follow-up of almost 11 years, and with underlying CKD, they decrease the risk of chronic kidney disease with plant-based diets. So, primary and secondary prevention both, 30% reduction in primary prevention, and if you take high protein diet, that there is a rapid decline in GFR in underlying CKD patient with animal-based diet. Keto analogs already discussed. Now, plant-based diets and complications of CKD. The major complication is acidosis. Animal-based proteins, they increase dietary acid load, whereas the plant-based proteins, they are acid. They behave like the bicarbonate tablet you are giving. In a study, in an RCT of 108 patients followed 3 years, 2 cups of fruits and vegetables, they were comparable to the sodium bicarbonate dose of 0.3 milliequivalent per kg per day. And it was about to lower the 50% deadly acid load. And the similar result was found in another study. Why? Animal proteins, they have amino acids methionine and cysteine, which are oxidized to inorganic sulfates, and plant-based proteins, citrate and malate, they are converted to the bicarbonate. Another thing is hyperphosphatemia. In animal-based diet, the phosphorus viability is 40 to 60%, plant-based 20 to 40%, and if you eat processed foods, 100% viability. Why plant-based? They have less viability because intestine lack the enzyme phytates. And both animal and human studies that shown that the plant-based diet lower serum phosphorus level, serum FGF level, urine phosphate excretion as compared to the meat-based diet. Another concept is what is the effect of plant-based diet on leaky gut. Plant-based diet basically feeds saccharolytic bacteria, which produce butyrate, and it helps in healing of the tight junctions. So vegetarians, they have 60% lower levels of PCS, pre-crystal sulfate, IC, IS, FGS, 23 TMO, advanced glycosylated, and production increased clotho. And so decrease in this uremic toxins have been linked to the progression of kidney disease, inflammation, insulin resistance, cardiovascular disease. By lowering all this, you can protect the person from all these complications. And plant-based diets and risk factor for CKD. Vegetarian diet and diabetes, various studies, meta-analysis, systemic review, all shows that dramatic reduction in use of with plant-based diet, with use of glucose-lowering medications, and in HbA1c and fasting glucose level. This is a nice paper who have studied basically the yogic diet on inflammation in type 2 diabetes. And every level, at brain, at liver, adipose tissue, pancreas, gut, there is decrease in the inflammatory markers. And this study is going on, basically plant-focused nutrition in patients with diabetes and CKD, results yet to come. About blood pressure, observational studies, meta-analysis, prospective studies, all shows that with too much number of patients, they shows that with plant-based diet, there is a decrease in mean systolic blood pressure and diastolic blood pressure. And if you consume 1 or more serving per day of any animal-based flesh, like red and processed meat, seafood, was associated with a 30% increased risk of hypertension. Plant-based diet causes afferent arterial vasoconstriction and decreased glomerular hyperfiltration. No over-concern with plant-based diet. Does it increase the hyperkalemia? No. Increase whole plant diet, you increase the dietary fiber, rapid bowel transient time, fecal potassium excretion. The true culprits are the juices, tomato sauces, dried foods, which increase the potassium. These are the selected observational and experimental studies examine plant-based diets and their relationship to serum potassium. And none of them has found to be having that there is a hyperkalemia. So, that is cause inadequate protein? No. Several studies does not support this. Typically, those eating plant-based diet in CKD attain 0.7 to 0.9 gram per kg BT of protein. And these are the large number of patients in 2 studies, Advention to Cohort and EPIC Oxford study. The plant-based diet is not per se a low protein diet. And a skilled dietitian can ensure protein intake if with plant-based diet. Another myth, plant-based diet is a low quality protein. Yes, grains, legumes, nuts, seeds, vegetables, they have some deficient amino acids. So, is it possible to get quality protein as a vegetarian? Yes. How? A mixed lacto-vegetarian diet meets all essential amino acids requirement. You combine 2 vegetable proteins will result in a better amino acids, but it is not like that to whole day you combine it. You do not need to combine foods at each meal to get a complete protein base. Should eat a variety of plant protein sources throughout the day. So, cereal deficient in lysine, abundant in methionine, you combined with pulses which are abundant in lysine, and rice plus dal, rice plus milk, you can have a complete protein. Another thing is kidney stones. Observation studies shown that the vegetarians have a low risk of kidney stones. Another concept which is going on nowadays is the green nephrology. So what is happening? More plant-based diet, less protein intake, delayed dialysis needs, reduced carbon footprint, more local products, and for environment benefits and less dialysis, and low carbon footprint when you switch omnivorous to plant-based diet, decrease carbon dioxide emission by more than 60%. So take-home message is, by all these papers, 26% decrease CKD incidence, decrease in all-cause mortality, improves cardiovascular outcome plus BP plus metabolic profile, decreased uremic toxins by microbiome changes. These are the all plant-based sites. So putative mechanism, primary prevention as well as secondary prevention, reduce the complications related to CKD, attenuation of the CKD progression. So manage your patient with green light go, yellow light caution, and red light no. So this is a discussion going on which is the Raskic versus Sattvic versus Tamasic food. You can decide who is eating Tamasic and Sattvic food. Sattvic food nourish the body and mind for lifelong health, and you choose yourself what you want to become and what your patient want to become happy with without any stress. This is my team, and my hospital is surrounded by all plantation, and we are basically already basically a plant-based, surrounded by a jungle. So thank you very much. The protein did not choose sides. If you are eating a variety of plants, you are covered. Thank you very much.
Thank you, Dr. Anurag Gupta. Do we have the discussion now itself or in the end? I think we can go with this particular talk. And then again we have in the last can have something. First is I was interested in the acidosis part. We are prescribing keto diets, and particularly in diabetics. Now we are seeing the cardiologists are also doing fasting ketone levels, which will cause the ketoacidosis and other problems and arrhythmias also. So, what is your take on this particular day?
We are not in favor of
also give
kidney
keto.
patients, sir. We are not in favor of any keto diet. Basically, in kidney patients, the most important thing is low protein diet, plant-based, but more important message is adequate calorie intake so that the patient is not having the protein energy malnutrition.
No, you also told about lacto-vegetarian diet, but if someone is vegan, either is lacto nor even egg, then what is your take about CKD progression?
The vegans, the studies have shown that even the vegan diet delayed the progression of the chronic kidney disease.